Let's talk about the combined oral contraceptive pills, popularly called the COC pills. They are birth control pills containing very low dose estrogen and progesterone that are taken daily by mouth. The COCs primarily prevent pregnancy by inhibiting ovulation. The synthetic estrogen and progestin in the pills work together to suppress the release of luteinizing hormone and the follicle-stimulating hormone from the pituitary gland. This suppression prevents the maturation and release of eggs from the ovaries. Additionally, the COCs alter the cervical mucus, making it thicker and less hospitable to sperm penetration. They also change the uterine lining, making it less receptive to implantation. The tablets are taken for 28 days. The active components are taken for 21 days and the iron components are taken for another 7 days. During the 7 days on the iron tablets, the client will likely bleed and then a new pack is commenced after 28 days. The COC pills help prevent ovulation. They must be taken daily and at the same time to remain effective. It should ideally be commenced on the first day of your menses or within 5 days of the onset of menses. If a client decides to commence it on the 7th day of her menses, she will need to take it for at least 7 days to get adequate protection. Hence, a backup method of family planning should be added during this period. If you miss a pill for more than 24 hours, you should take the next pill and use another method of contraception to protect yourself. You will need to take the pills correctly for another 7 days to regain adequate protection. The failure rate is less than 1% when the pills are used correctly by the clients. The COCs has several side effects, and some women who have used this combination complain of changes in their menstrual pattern, which may include irregular bleeding, bleeding for fewer days than in the past, or no menses at all. Some persons complain of nausea, headache, dizziness, weight gain, breast ache, and acne. The COC pills proffer several benefits to the client who takes it. They are highly effective, and when they are taken correctly, they offer about 99% protection in preventing a pregnancy. They can also help regulate menses and make them more predictable and reduce the intensity of menstrual symptoms. Many women experience lighter period and reduced menstrual cramps when using the combined oral contraceptive pills. And some COC pills or formulations can help improve acne and promote clearer skins. Long-term use of the COCs is associated with a reduced risk of ovarian and endometrial cancer. And finally, the pills are used for regulation of IVF cycle by healthcare professionals. The COC pills can present several disadvantages. Number one, it does not protect against sexually transmitted infections. 2, it has to be taken every day at about the same time for it to be effective. Number 3, it comes with a risk of weight gain, headache, nausea, vomiting and leg swelling. There may be also an increased risk of bleeding, spotting after the menses of a client, and this can disturb the sex life of both parties. Rare medical problems associated with the COC pills include breast and cervical cancer, blood clots in deep veins of the legs or the lungs. While the COC pills are safe and effective for the majority of women, including adolescents and women over 40 years, they are unsafe for women who are hypertensive, women with a heart disease, or women who are at risk of forming blood clots. Women with liver disease and women who smoke should not take the COC pills. Women who have had abnormal vaginal bleeding and the cause was not found will find the COC pills not suitable for them. If you are breastfeeding a baby and decide to use the COC pills, there are several recommendations. If you are exclusively breastfeeding a baby, you need to commence the COC pills from 6 months of childbirth because the pills could reduce breast milk production. Healthy women who are not breastfeeding their babies can commence the pills 3 weeks after childbirth. The choice of a specific COC should be made in consultation with a healthcare professional. Factors such as a woman's medical history, lifestyle, and preferences are important considerations. Providers can help determine the most suitable formulation, manage potential side effects, and address any concerns the woman may face. The COC pills are a convenient and effective method of breast control that provides women with reproductive autonomy. They offer numerous benefits beyond contraception, including menstrual cycle regulation and the management of several health conditions. As with any medication, it's important to have an informed discussion with a healthcare provider to choose the most appropriate combined oral contraceptive formulation based on individual needs and medical consideration. Thank you for watching.